Well, the tie-ups at the U.S.-Canadian border created quite a few problems on both sides of the river, but also showed us an interesting collision over policies regarding the coronavirus. Canada has had far fewer cases and far fewer deaths per capita, but with tighter restrictions and controls that, as we saw, had some Canadians reaching the boiling point. Well, what are we learning about policy and pandemic? Let's talk about it with Dr. Donald Venn. He's an infectious disease specialist at McGill University, regarded as one of the top epidemiologists in North America, and he joins us today from Montreal. And Dr. Jim Baker, the Ruth Dowdone professor at Michigan Medicine and the man behind the Pandemic Pondering blog, who we've turned to quite a few times now on the program. Dr. Venn, I want to start with you, and let's start with whether it feels possible to you to really compare the U.S. and Canadian responses. Are we alike enough, or are there too many population and system differences to be helpful?
Well, I have to tell you, I think that the differences are pretty enormous. Yes, we are North American neighbors. I've certainly lived in the U.S. and I have a lot of friends in the U.S. But I think that there's several different major levels. First and foremost is our healthcare system. It's a right. Socialized healthcare system which provides equal access to medical care regardless of your socioeconomic status. And of course, we also have a different framework for how healthcare is governed and rolled out. And we also have differences, obviously, in adherence to public policies.
We do have, I was surprised to read, though, when it comes to demographics, we are more alike than not when it comes to things like obesity and hypertension rates, a lot of the sort of comorbidities. Correct, Dr. Venn?
Yeah, absolutely. So our age pyramids are very similar in terms of we have a predominant, we have a very heavy, elderly and frail elderly populations, both institutionalized and community dwelling. We have a lot of similar comorbidity rates, the same comorbidities themselves in terms of cancer and obesity and heart disease. So that in itself certainly doesn't explain the differences we've seen between countries.
Yeah. Dr. Baker, when you just look at it on the face of it, Canada, far fewer deaths, far fewer cases per capita. Is it just that simple? Does that mean that Canada did a better job of managing this than we did, or is it much more complicated than that?
I think if you look at deaths and illness, they did a much better job than we did. You also look at vaccination rates. They were over 80%, and we were 63 or so. So I think they did a much better job there. But if there's one thing that I think they did really well at is the consistency of their response. We seem to go back and forth. We've let up on restrictions before we got the population vaccinated. And that did two things. Number one, it allowed a lot of people to get sick and die. But the other thing is it undermined confidence in what the government was doing. So that people would see these outbreaks and think, well, what we're doing isn't working. The vaccines must not work. And that unfortunately created a lot of problems when we then tried to backtrack and get people covered.
Interesting point, because Prime Minister Trudeau got to lead Canada through the whole thing. We had an election in the middle of ours. That complicated things quite a bit, didn't it?
It certainly complicated things. I think there were problems on both parties in terms of the approach to this. But even before the election, people were releasing restrictions before the population was protected. And the key for these restrictions was they were really a temporizing measure until there was a definitive way to protect people, like a vaccine or an antiviral drug. And unfortunately, we weren't able to wait long enough to get enough people vaccinated that the population was really protected.
Dr. Venn, as I mentioned at the top of the program, there is something very much, it seems, in the Canadian character about being compliant and following the rules. And yet we also saw that we were arriving, I guess, at sort of the breaking point for a lot of folks in Canada over these restrictions. Maybe things have timed out pretty well here, that we're starting to see Omicron subside. Could Canada have gone on with its same level of compliance if it had gone past this, or needed to go much past this point?
Well, first of all, I think you raised a very important point, right? Which is that 80% or so of the population wanted vaccines. So when there were vaccines that were made available, in fact, at the beginning, we even had a rationing of supplies. There was, sort of a very strategic approach to rolling out the vaccines, targeting and providing it to the most vulnerable, which was at the time the elderly, and then slowly rolling them out to different patient populations based on certain risk factors, notably age. And at that point, people were getting the vaccines. They bought into the 2-dose concept. Eventually, people also bought into the 3 or 4th dose concept that they were immunocompromised. But the issue, of course, is that this pandemic has stretched out too long. It has come with science that has come at breakneck speed, which may go over the head of a lot of the general public. And as a result of that science, there have been changes in policies, even changes in the number of doses required and the timing of the doses. And the problem is that that pandemic fatigue was a perfect nest for the convoys and the other protests that people were starting to sort of manifest. A minority voice, nonetheless, but they were manifesting, and that's what you've seen recently.
Dr. Baker, does it boil down then to, if we could get rid of, we had all these arguments, of course, over masks and over social distancing, what places should be open, closed, things like that. If we had just been as willing to adopt and adapt to the vaccine as Canada was, what difference would that have made, you think?
Well, I think it would have helped tremendously, but we made mistakes even before then. We weren't consistent in what we were telling people. People can do one thing very easily. So I think if we just told them to avoid crowds and to wear a mask, they might have done that. But we're giving them information about, washing down surfaces with bleach, about bleaching even their groceries when they came home. And people really got confused. Even the government initially suggested we didn't need to mask. So in fact, there was an undercurrent of disbelief by the time we got the vaccines. The vaccines were inappropriately marketed as a way to sterilize the population. People then believed that if they would never get infected if they got the vaccine, and that was never the point of the vaccine. So in fact, when they started seeing these so-called breakthrough infections, which were infrequent and usually very mild, they lost faith in the vaccine. So I think initially there was a great impetus to get vaccinated, but we actually undermined our own desire to get vaccinated with the message that was being given.
Well, that's a pretty good encapsulation, perhaps, of a mistake made on our side of the border. Dr. Venn, if Canada had it all to do over again, do you think were there mistakes made in the Canadian approach that you would change from here? If it happens again, and we kind of have to doubt that this might be our last go-around with a pandemic, right?
Well, all the issues that Dr. Baker just raised actually were also points that arrived here. There was this overselling of the impact of the vaccines. There was this mixed messaging by government, public health policy or agencies. So all of that happened here. The issue, however, is that it didn't happen in such a polarized fashion, at least not in the first, 2 years or so. Yeah. And it also wasn't one or the other. So it wasn't that we did vaccines or masking. We had indoor masking, in fact, even eventually upgrading to better types of masks for indoor spaces, at a much longer period of time than the United States, as we were doing the other things like the rolling out of the vaccines and all the other measures. So I think what happened for us is that we were perhaps slow to come out of the starting gates, but we had a lot of layered approaches. We weren't perfect, trust me, and our governments are, both at the provincial and federal level, are actually sort of, perhaps to some of us abandoning ship a little bit too early. And there's some concerns on that end. But I think up until now, we've been able to use multiple layers through vaccinations and other public health restriction of social activities to be able to keep things somewhat under control.
Dr. Baker, I've only got a couple seconds left. If something like this were to happen again in the U.S., have we been able to learn any lessons moving forward, or are we still so polarized and politicized that we can't fashion a better approach?
That's a very good question. I think we are incredibly polarized, but one thing we need to understand is these are inherently political decisions, and they can't exist in a vacuum in a public health perspective. So in fact, we need to get the government together and speaking with one voice early on to have an effective response. And that's something that didn't happen here.
Sure didn't. Dr. Baker in Ann Arbor, Dr. Vin in Montreal, great conversation and a lot for us to think about. Thanks so much for the time today.